Welcome back to Aloha Stadium, University of Hawaii football and OC Sports. The Rainbow Warriors getting ready to take on Utah State. Here's a look at Hawaii's wounded Warriors. Now, luckily, no new names added to this list after last week, but obviously you have 4 guys there out for the season. Julian Jenner out 4 to 6 weeks with a leg injury, and Jeremy Higgins more than likely done for the year, but hoping he could come back. Now is a good time to take a timeout for health, presented by Straub. And we want to welcome to the show our good friend, Dr. Nick Crawford. And Doc, when you head into a college football game and you see everything that goes around in a football game as far as injuries goes, as far as the amount of staff that's here, how difficult is it for a doctor to assess an injury, to come up with what is going on based on the amount of adrenaline that is running through these student athletes' veins as far as in masked pain? You can't give them the 1 to 10 test as far as how much does this hurt because of all that adrenaline. How difficult does it become to assess injuries?
It can be very difficult, all the way from the simple injury where you're looking at an athlete with a minor sprain and you can get them off the field, and you have to quickly assess if that's a triage situation where you're going to need to get some help. We have an ambulance parked here, can be quite severe. So these athletes have a lot of adrenaline pumping. They're playing college football, and you have to really assess the acuity pretty fast.
Does it become a battle sometimes between doctors and players as far as, no, you cannot play?
Unfortunately, I played football and I battled my own doctor. You really want to listen to your doctor, and they know what's best for you, but it is a battle between not only the player but sometimes the coaches. These athletes want to play. They're fired up, and they don't want to hear that they're hurt and they can't play.
How much of a time element is there? Because I understand if they're in your regular care, you would take more time with them. It seems like there's a certain more urgency to get them back on the field, or let me make a diagnosis.
Yeah, you don't want to waste time being on the field with these athletes if they don't need to be, but you also don't want to take them off the field if they're truly hurt. So again, assessing the acuity and hopefully not making a mistake, and you can really get that athlete appropriately off that field if necessary pretty fast.
Dr. Nick Crawford, thank you for your time once again. That was a Timeout for Health brought to you by Straub. We're going to be talking more University of Hawaii offense coming up. It's UH football against Utah State. More Game On coming up after this.